Doctors of Reddit, what are some of your worst experiences with anti-vaxxers? Standard stuff really. Had a kid on a ventilator with a preventable illness at a major research hospital in California. The mom was anti-vaccine. The kid began to deteriorate and the mom spent a lot of time reaching out to her anti-vax community. One visited her in the hospital and said, "Honey, there was nothing you could do. I lost it at that point. Nothing you could do, except vaccinate your child, which would have completely prevented it." I'm a veterinary technician. I've had someone ask me if vaccines are going to give their dog autism. LOL. Yes, your dog will be good at math and have a rough time communicating. My stepmom is a pediatrician at a major hospital here in Italy. She told me the worst thing she saw was her anti-vaxxer mom wailing and screaming after her 12-year-old son died of meningitis. The mother didn't let the son get the meningitis vaccine. Stepmom told me as soon as she walked in the room after getting called for an emergency, all the son's limbs had gone necrotic and he was bleeding from practically every hole in his body, including his eyes, since his blood couldn't congeal anymore and was like oil leaking all over. She told me she felt so pissed at the mom when she received the information that the mom hadn't vaccinated her son at all and this was all preventable. That's really sad. I don't know, but I think risking even having autism isn't worse than dying from meningitis at age 12. Jesus. Not a doctor, but was previously in a position where I hired RNs. One interview concluded shortly after learning that this registered nurse I was speaking with was wholeheartedly against vaccinations and went on to paint pretty much all of Western medicine as hocus pocus. I think she takes the laughter is the best medicine phrase literal. I just wanted to say, why the F did you go to school for this profession? And did you not learn a dang thing? Believe I shared this before on Reddit. I had a 7-year-old showing signs of a serious illness. Her teachers initially noticed it before anyone else. The child had been sick for a few days that turned into a couple weeks. The teachers told the parents over and over something was wrong. The parents ignored the signs and claimed it was nothing bad or it was a cold, something minor, etc. They finally came to me and the child showed signs of measles. Within about 10-15 minutes I indicated that this is not a cold and this seemed to be measles, based on what they verbalized to me and what I saw. To confirm, I examined the child's inner cheek and did a full body exam where she, the child not the parents, pointed out a rash, both confirming measles. The parents indicated that they did not believe in vaccines because their previous doctor told them it was unnecessary as long as the child ate healthy and stayed active. It was a family friend who worked in naturopathic medicine, not a licensed doctor. After making the diagnosis and having a very tough conversation and informational session with the parents, I provided them with prescriptions to help with the measles and bring as much comfort as possible to their child. I had to break down that their child, 1. Cold infected children and families with a very dangerous but preventable disease, 2. Cold had permanent brain nerve damage, and 3. Could have freaking died. I didn't curse at them, but boy did I want to. The child had measles for at least a month before seeing me. To show how serious this is, measles does not show signs or symptoms in some cases for 10-14 days. So because they refused to vaccinate their child, at least 2-3 weeks of exposure to other kids and teachers went by. Somehow they were able to bypass school district requirements for getting vaccines. They did not have a religious exemption. No vaccinations aside, what kind of crappy butt parent do you have to be not to notice your child is sick before their teacher? This experience isn't necessarily the worst, but mainly just sad. I had a 1-year-old infant in the NICU with hib meningitis, which is a vaccine preventable illness. I didn't actually have the heart, or felt there was any reason in the moment, to explain to the parents that what was happening to their child was fully preventable. Long story short, their child came into the emergency room, quite febrile and non-responsive. The whole workup was done and he was diagnosed with hib meningitis and sepsis and was admitted to the NICU. Unfortunately, he was already fairly advanced into the course of his illness and went on to develop multiple awful complications. Despite being started on the kitchen sink's worth of antibiotics, he developed multiple brain impairments, large collection of pus and bacteria that fill the skull, requiring multiple drains to be drilled into their skull to relieve pressure, or else the brain would have been compressed. To make things worse, the kid incurred multiple ischemic strokes, dead brain, and also developed hydrocephalus. The brain has its own circulatory system which can get clogged with pus bacteria, causing fluid to build up and exerting pressure on the brain. Against all odds, this tiny baby survived the ordeal. You can have your own ethical debate over whether a child that neurologically compromised should have lived, since they will be so profoundly disabled that they will likely require full-time nursing care, and may only live a few more years before dying of pneumonia. But that was the situation. Jesus, if that's not the worst, I don't think I want to hear what the worst is. Went to a chiropractor one time to fix some lower back pain. They had posters all over about how harmful vaccines are and that having your back adjusted regularly, even as an infant, could help fight off those kinds of diseases. I asked the receptionist if they actually believed that, and she gave me a 10-minute lecture trying to justify it. I just looked and said, remove me from the patient list because that is the dumbest thing I have ever heard. There was an anti-vax mom who brought her kid into the ER and demanded that her kid be roomed right away and seen first because he couldn't be around all these sick kids. Imagine knowingly putting your child in danger and then demanding and feeling entitled to the best care. My dad's a doctor. He told me that once a mother came into his office with her son for a checkup and he recommended that her 6-year-old get vaccinated for measles, mumps, rubella because she hadn't vaccinated him yet. Just 4 weeks later she came in with her son and he had measles. She yelled at my dad for not curing him in the hour and a half they were there. She got angry and went to the ghetto pediatrician who sold her the same medication. And later she still didn't vaccinate her son because aluminum and toxins. That's exactly how my dad said it. I worked in a pediatric ED for many years. Had a young boy come in, don't remember exactly how old, maybe 8 or 9. Comes in obtunded and stiff as a board. We take home to the resuscitation room and do all the full workup stuff including a spinal tap. It was work to try to position him because he was so stiff. I am assisting with the tap. The fellow was able to get into the intervertebral space and a milky fluid literally shoots out of the needle and onto her chest. She hooked up the manometer to measure the pressure and the fluid climbed all the way to the top and out even with the extension added to it. I had never seen that before in hundreds of taps. I don't remember pressure, but as you can imagine it was astronomically high. We got the kid as stable as we could and transferred him to the PICU. He ended up living, but lost 3 of his extremities due to sepsis, as well as severe cognitive impairment as a result of the high pressures. Cultures showed H-flu meningitis, which is the most common form of meningitis. He was never vaccinated. The hip vaccine is more than 95% effective in preventing meningitis. It was sobering to watch the parents realize their decision to withhold a vaccine has unimaginably altered the course of their lives and the life of their child. He'll have to live the rest of his life disfigured, useless, alone, and in eternal agony wishing he died, but at least he's not autistic. Not necessarily anti-vaxxers, but a sad story related to not wanting to listen to the doctors mixed in with not being a good parent. I'm in medical school when this happened. Seeing a new patient to establish care. Patient is a 9-year-old girl. Get into the room and she is on the table wearing glasses. Okay, that's cool. I had glasses at a young age also. Then I noticed she has strabismus, is cross-eyed. Talked to the mother to get better history. Turns out she was born with strabismus. Now, there is a relatively easy way to fix this. Involves surgery and then wearing an eye patch. For most people, this fixes the issue and their vision is unaffected. The mother was against the surgery, but was someone finally convinced her that it would help, so she got it done. The patient was sent home and mother was given specific instructions. Keep the eye patch on constantly. Well, guess what? Eye patch isn't exactly comfortable and kid gets fussy all the time and doesn't want to keep it on. So mom decides not to make her wear it. Strabismus returns. By the time I saw her, the patient's vision was terrible, and she was almost legally blind. She could read the biggie on the eye chart, nothing else, and that was with 1-month-old glasses. She is cross-eyed. I inform the mother that they can get the surgery again. It will help prevent her vision from worsening and help with being cross-eyed. Mother says the surgery is cosmetic, and the eye patch is too bothersome, so she doesn't want to do it. This 9-year-old girl is on track to become legally blind in the next couple of years. She will remain cross-eyed for the rest of her life, all because her mother couldn't be a parent and force her to wear an eye patch for a couple of months. Turns out there is other evidence of bad parenting. Kid brushes her teeth maybe once a week because mother doesn't make her brush her teeth if she doesn't want to. Long story short, if you are a parent, be a freaking parent. I am a university professor of biological sciences. I was teaching a course this semester that covers how to appropriately conduct research in a variety of ways as well as how to perform personal not publication worthy research. I remember hearing one of my students say that they were anti-vax at the beginning of the semester. Didn't really bother me because I realized that they were also part of one of my courses where I just so happened to have a lecture planned to analyze Wakefield's MMR autism paper, find points of major error bias, determine the severity of the errors, how to fix them, and discuss his methodologies and results while being compared to the dozens of studies released after his that utterly destroyed his paper. After that lecture, I never saw the student again. Unfortunately, this taught me that when you deal with this group of people, there isn't really a way of convincing them otherwise. They have been brainwashed, and they like their confirmation caves. I work for a vaccine manufacturer, and my title is raw material engineer, aka I work with vaccine ingredients for a living. When an AVER asks me, on social media or in public, if I know what's in a vaccine, I basically cackle and crack my knuckles. They also don't seem to have an answer for why I give my children the same vaccines if Big Pharma is trying to poison people. I am Big Pharma. I'm a veterinarian. Every day I have to convince some reluctant pet owner that I'm not in the pocket of big rabies and I'm making recommendations for preventative care based on state law, medical research and good judgment. The memorable people are the ones who listen to me. My advice saves their pet's life in one way or another, and they're still pee about it. Your dog definitely needs a Lyme vaccine. Why? It's not perfect. Your last dog died of Lyme nephritis like 2 months ago. This vaccine is 93% effective. Some people. 19-year-old comes on a gurney, deep coma, respiratory depression, foam issuing from the lips, mother frantic. EEG reveals a pattern typical of subacute sclerosing panencephalitis, a sequela of common measles. It's preventable, people, but not curable. They buried him a few weeks later. My 8th grade English teacher was anti-vax and pregnant at the time. She would constantly tell us about how bad vaccines were and stuff. So one day the science teacher spent an entire lesson just talking to us about how vaccines are good and don't cause autism. A few years later I was talking to my friend from 8th grade who still talks to our science teacher, and he said that the English teacher's baby had autism and wasn't vaccinated. Then obviously the doctors had somehow snuck some vaccine into the baby. Yeah, I'd rather my child get sick naturally than be exposed to chemical vaccines. A parent, after I spent 10 minutes describing to her in graphic detail all of the ways preventable diseases could maim and kill her infant. I just don't get why people think that natural in any shape or form must automatically be good for you. The universe is under no obligation whatsoever to be nice to humans. My mom did not vaccinate me as a kid. As of 2 days ago I officially have rubella. When you're well again, get your vaccines. It's never too late to get the ones normally given in childhood. I have mild autism. I made the mistake of saying that I was autistic in a public place to my friend. This lady heard and came up to ask if I was vaccinated. I said that I was, and she had the most triumphant look on her face. I realized my mistake and left right away with my friend. I'm not a doctor, but I have a story that I'm pretty sure that fits here. We had neighbors that have become lifelong family friends. They have a daughter the same age as my sister, and she got diagnosed with autism shortly after getting her MMR. A couple months after her diagnosis, the paper came out saying vaccines caused autism, and the mom believed it. It was new information. No one really was sure what to believe. Anyway, fast forward 4 years and the mom is pregnant again. She NO'd getting her new baby vaccinated with the MMR. She did, because, in her words, I'd rather have another autistic child than one in the IQ. The new baby is completely typical and she now doesn't believe in the anti-vax crap. My point is, at even the height of the autism being caused by vaccine scare, she was smart enough to get her kids vaccinated. And I will never understand why people don't protect their kids as well as herd immunity. Finally, a comment I can get behind. I'm so sick of hearing about parents who would rather have a dead child than one with autism. If the myth were true to begin with, Currently in my first trimester and this baby is getting every freaking vaccine they'll give it. I ended up with scarlet fever as a kid because people are so obtuse. Just breaks my heart. Pediatrician here. As a medical student, I watched her baby die from rotavirus BC. Mom thought vaccines cause Alzheimer's, not autism, Alzheimer's. And she didn't think he needed to go to the hospital when he hadn't kept down a feeding for 12 hours because sometimes kids just do that. My current winner is a mom who refuses vaccines for her kids because they cause autoimmune disorders. Her 2 sisters have chronic Lyme and her brother has scoliosis, all due to those nasty vaccines. Oh, and her grandpa and dad both died from heart attacks because they had had the flu vaccine the previous season. All these autoimmune disorders in one family. I just don't know what to do. She likes to bring me articles from Merkler and Health Nut News to prove her point. Yep, vaccines cause Lyme disease now, not ticks. Vaccines. While discussing vaccines with a mom one time and bringing up my experience working with the immunocompromised population, she said, "I don't care if someone else's kid has cancer. That's their problem, not mine." And that right there is a huge part of the problem. Selfishness. I vaccinate my children not only for their own health, but for the health of others. Had a patient come to the hospital for possible heart attack. I asked if they had gotten a flu shot or the pneumonia vaccine. They went into a long rant about how vaccines are poison and they don't take any medication because they swim in the ocean and it purifies all the toxins that they acquire. Then they started having chest pains, so I gave them a nitroglycerine pill. They spat it out because they hated it. Well, you don't take your meds for high blood pressure and high cholesterol, you will have a heart attack. So not just anti-vax, but fully anti-medicine and science. Did you ask them why did they even bother coming to the hospital? They could have just gone to the ocean and swam until their heart attack went away. After I sent out invites to my kid's birthday party, I found out one of her friends from dance was unvaccinated. My daughter's best friend is in remission from leukemia and is immunocompromised. An unvaxxed kid could kill her. I uninvited the dance kid and very nicely explained the situation. Her mother loses her crap and tries to get us kicked out of the dance school they attend. The dance school owner is an older lady and had no idea there were idiots these days that didn't vax, so she implemented a new rule that students had to be up to date and the unvaxxed kid had to find a new dance school. I felt bad for the kid, but her mother is a sociopath. Herd immunity saves lives when it comes to kids fighting cancer. This is the thing about anti-vaxxers that really drives me nuts. I feel terrible for their kids getting put at risk, but it's even worse than that. They are putting at risk anyone who is immune compromised, elderly, sick, pregnant people, newborn babies. It's selfish and irresponsible. I'm not a doctor, but I work in an urgent care clinic. I had a mom come in that complained about her son having nasty eye infections, pink eye lasting several weeks. She was vehemently against vaccinations, and when I asked if she had been giving her son over-the-counter med, she said, "Well, I read online that breast milk would work, so I've been just pouring it in his eyes and I don't know why it's not working." Pharmacist here. I don't get a whole lot of pushback. Most common is a fear of needles. All of my patients are 18 or older. I have had a few loons with the mind control conspiracy and a few. Vaccines do nothing but cause problems and I can tell you all about it. My staff and I laugh at them after they walk away. Then I die inside cause it is becoming more prevalent. You've been visited by swining thick boy. Like and comment swing well thick boy and you'll be blessed with many thick woofers in your life. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.